Exercise is not the only important part of a healthy pregnancy. Diet is equally as important. This is the time to begin building the strength and fortitude you will need for both a positive birthing and parenting experience. Eating well does make a difference. Let's start with the recommended amount of weight gain during pregnancy according to the Institute of Medicine. For the average woman, a weight gain of 25 to 35 pounds is recommended. If you are underweight, 28 to 40 pounds is healthy, and if you are carrying twins, 35 to 45 pounds. But if you are overweight, only 15 to 25 pounds is recommended. How do you achieve appropriate weight gain and maximize nutritional benefits to your baby? First, we'll address some basic do's or nutritional goals divided by trimester. It is very important that you don't skimp on calories to preserve your figure. Pregnancy is not the time to diet. Inadequate weight gain is associated with low birth weight babies and should be avoided. But pregnancy is not the time to overeat or eat for two. Excessive weight gain during pregnancy is associated with bigger babies, uncomfortable moms, difficult deliveries, and possible medical complications including high blood pressure and diabetes. The first of the do's that we will cover is fluid intake. This is most important. Fluids are needed to build new tissues, aid in digestion, prevent constipation, carry nutrients, and to keep up with the body's expanding blood volume. The American College of Obstetricians and Gynecologists recommends 6 to 8 8-ounce glasses of water a day and an increase to 12 glasses a day if you are exposed to increased temperatures or during exercise. During a workout, 1 big glass of water is recommended every hour, certainly 8 ounces before and 8 ounces at the end of the workout. Now let's look at your nutrition by trimester. Let's start with the first trimester. Energy needs at this time are actually negligible since the baby is so tiny, approximately the size of a grain of rice at 4 weeks. This will soon change. It is important to get into a good nutritional routine of a well-balanced diet, including foods from the 4 food groups at this point. You should also try to incorporate organically grown foods when possible. The USDA recommended daily food guide includes 4 servings of protein, including fish, chicken, meat, or vegetable combinations to meet this requirement, 4 servings of low-fat milk and dairy products, 4 servings whole grains, including cereals, pasta, breads, and legumes, 2 servings of vegetables or fruits high in vitamin C, 2 servings of leafy green vegetables, and lastly, 1 serving of other fruits and vegetables. 400 micrograms of folic acid, found in most prenatal vitamins, is also recommended in the first trimester to reduce the risk of neural tube defects. Moving on to the second trimester, real growth begins at approximately 14 weeks of development. You will now need an additional 300 calories a day. Moderately active women require approximately 2,900 calories a day, and very active women may even need a little more. These should be high-quality calories. Your blood volume expands by as much as 50% during the second trimester, and hence you may require additional iron either from a supplement or dietary modification. Your doctor will check your blood count at this time to see if this is necessary. Iron absorption is enhanced by both vitamin C and folic acid, so consume these elements in combination with one another. You should also pay close attention to your fiber intake during the second trimester, since constipation becomes more prevalent at this time. Lastly, you may be noticing more frequent heartburn at this time, so be conscious of eating and then lying down after a meal. You may find you need to eat smaller amounts more frequently to avoid this common problem. Lastly, the third trimester. The baby is now 12 to 16 inches in length and weighs between 2 and 3.5 pounds at the beginning of this trimester. You should be gaining approximately 1 pound per week at this point until the last 4 weeks, where you may even lose a few pounds. Again, your iron intake is important because you will be needing the extra stores in preparation for blood loss at delivery. Also, your calcium intake should be maintained at least 1,000 milligrams a day, the equivalent of 3 to 4 cups of low-fat milk, for strong bones in baby and in mom's breast milk. Some don'ts. Caffeine. Caffeine only in moderation. Caffeine can act as a diuretic to your system and hence can lead to dehydration in moms and especially in active exercising moms. It is also a stimulant. Alcohol in any amount is not recommended because of its known association with miscarriage, developmental problems, and low birth weight babies. Raw or undercooked meat, poultry, eggs, or seafood, these may harbor harmful bacteria or even parasites and hence should be avoided. In conclusion, combining a healthy diet with an exercise program approved by your physician or midwife will enhance your pregnancy and birthing experience. Your pregnancy should be viewed as a beautiful, life-changing event. Although it may last only 40 weeks, the results of your prenatal efforts will last a lifetime.